Are you confused by home care, home health, and hospice? Let's clear that up. Hi, I'm Greg Eldridge with Home Helpers Home Care of Alpharetta, and today we're going to go through the differences between home health, hospice, and home care. We get calls all the time from family members who have a loved one in the hospital or rehab about to get discharged, and they hear home health. The doctor is prescribed home health, and they think that's home care. And they're different but work very well together. So let's start with home care. So, home care, you have a caregiver that is there to help your loved one with a variety of things that they may need help with to be able to be safe at home. Things like personal care, so bathing, dressing, toileting, transferring, helping with their physical therapy exercises, that kind of physical help. And that all of that help can range from just standby assistance for safety, just making sure your loved one is in and out of the shower okay, all the way to full care, where they can't do anything for themselves and we're there to do all of it. So that's kind of the personal care bucket of home care. And then the second is companion care. And that can include a whole bunch of stuff. Being a pleasant companion obviously is hugely important, but things like helping around the house with laundry, light housekeeping. We're not a cleaning service, but helping with like vacuuming, dusting, doing laundry, changing bed linens, helping with medication reminders, meal preparation, and then just companionship. So, whatever your loved one is into, we want to help them do that as much as possible and maybe even reconnect with some things that they have stopped doing for whatever reason that they used to love to do. We would love to find out about those things. And for us, outings are a big deal, getting in the car and going somewhere. So if your mom loves to go grocery shopping, we want to go do that, or wants to go to a craft store, we want to go do that, or just drive around on a beautiful day. So all of that is kind of in that companion care bucket. Keeping your loved one safe is the first priority, and that's typically why we're with all of our clients. And home care is typically paid, it's either private pay, if your loved one has long-term care insurance, that's a policy that they would have had for typically decades, where they pay premiums, and at the point they need to either move into an assisted living or need care like home care to be able to stay at home safely, that's where the long-term care insurance policy kicks in and pays for that. The VA also has a really good program helping veterans that need care, and there's a couple different programs they have: the aid and attendance benefit, and then just the care and companionship, which is for any service member that has whatever they're going through as a result of something that happened during their time of service. They are very good at getting those veterans benefits. Then Medicaid is also a payer source. It can vary widely across the US in terms of which states are good for Medicaid or not. Some states are much more difficult to get coverage, other states are much easier. And then Medicare Advantage is starting to make some noise about paying for some level of home care. Again, that varies widely state to state. So those are kind of the payer sources. If you want to get some detail about the type of care that we really provide and what we try to do with all of our clients, we created a video about our integrated wellness program that I think would be super insightful. And our type of care can range from a few hours a day to round the clock care, whatever your loved one needs. And we are there specifically just for your loved one. That's it. So that's kind of home care. Home health sounds very similar, but it's quite different. Home health is much more medical care. And you can think of home health as whatever your loved one is to receive from home health. They have either like a physical therapist, an occupational therapist, a speech therapist, or if it's wound care, IV antibiotics, things like that, where the person that's going to be administering whatever it is your loved one is about to receive is going to be there, come to their house, do whatever they're doing, and leave. And that's it. So they're not there to do any of the stuff that home care is there to do. And similarly, home care doesn't do what home health does. So, home health and home care are actually work well together because they do things we don't do and we do things they don't do. And one of the areas of overlap for us is with physical therapy homework, because if your loved one has home health and has physical therapy coming out, they're going to come out 2 days a week and then have a list of exercises for your loved one to do. And they'll be like, hey, make sure you're doing these exercises when we're not there. And that typically never happens. So we are hyper proactive about making sure that PT homework happens, because the difference between 2 days a week of physical therapy exercises and 7 days a week is massive in terms of the way your loved one will recover and how fully they will recover. So home health and home care are definitely not exclusive. They work together. Home health, the good news about home health, it is fully paid for by insurance, whether that's private insurance, Medicaid, Medicare. It is not it's not a forever period of care, though. It's very specific. So like with physical therapy, your loved one needs to be showing progress. At whatever point they plateau, physical therapy will end. Or, with wound care, they get the wound under control and then that ends. So it's for a specific period of time where someone comes to the home and provides a treatment to your loved one that will end at some point in the not too distant future. One thing to note about home health is those services require a doctor's order for them to be paid for by insurance. So if your loved one's doctor feels that your mom should be getting physical therapy at home, he or she will write a physical therapy home health order that will then yield a therapist coming to your loved one's home a couple days a week for several weeks, and then that will end at some point. But that requires a doctor's prescription to get that going. Unlike home care, where that's just a choice that I need care to stay safe at home, that's an individual choice. The third thing we'll talk about is hospice. I know that's the scary H word, but the reality of hospice is it provides tremendous support, and it doesn't necessarily mean that it's end of life. We've had a lot of clients that have been on hospice for years. Some even are on it and come off of hospice. Hospice requires a terminal diagnosis of 6 months or less, but that's just a diagnosis. That's not definitive. And as I mentioned, we've had clients that every 6 months they keep getting their hospice order re-upped because the diagnosis hasn't changed. It just isn't happening within 6 months, but that doesn't mean it can't be extended for years or that someone actually does come off of hospice. The beautiful thing about hospice is it provides a tremendous amount of support to your loved one, the patient, as well as the family. And that support comes in a variety of different ways. They have social workers on staff. So any of the, kind of checklist stuff that you might be thinking you need to deal with all of this, that's what they're there to do. They have a chaplain on staff. So another area of support they have is chaplains. So providing spiritual comfort to family and the hospice patient. They take over all the medication. They're really there to make sure that your loved one is comfortable. So if there's pain involved with whatever their diagnosis is, they want to make sure that is not being experienced by your loved one. Sometimes people think hospice, oh, my loved one's going to be drugged all day. That's really not the case. That it is done very discreetly, fully depending on what your loved one needs. So I know hospice can be, I'm giving up, or it's scary, and it's really not that. It's just accepting support at a time when support is often very much needed. And hospice is a beautiful thing, and most hospice workers, or most folks that work in a hospice environment are really beautiful, heart-motivated people. That's why they're in hospice. They understand that is required in that field. And so it's a really beautiful support. So a couple other details about hospice. Hospice is covered by insurance, whether that's private insurance, Medicare, Medicaid, and it does, there's an intake process involved where, they have Medicare guidelines they have to adhere to if someone is hospice eligible or not. But those are kind of the threshold requirements, but it is covered by insurance, whether that's private or Medicare or Medicaid. So we've highlighted some of the details of hospice, home health, and home care. How do they kind of work together? So home care can work with hospice or home health just to provide additional support. So again, home care is one-on-one care. When we are with a client, we are there for them. Even if hospice is there, we're there all the time. Hospice can kind of come and go depending on a social worker will come and leave, or they'll have caregiver come to do a specific task and leave, or the chaplain or an RN. And, they have a lot of staff that are very involved with the client, but they're not there for an extended period of time like home care is. And hospice can be, families going through hospice often need the support of home care to just take care of their loved ones so that they can focus on just connecting and supporting. So we work very well with hospice. Similarly with home care, we are there for more of an extended period of time. Home health comes out for specific treatment episodes and leaves. And then we support the physical therapy, occupational therapy, and speech therapy homework as well. Now, home health and hospice typically do not work together. They're really mutually exclusive. If you're on home health, kind of by definition, you're not hospice eligible, because home health, if you have a terminal diagnosis, you're not going to be typically getting home health. Or if you choose hospice, it precludes home health. So you very rarely see home health and hospice working together with a patient, but home care and hospice and home care and home health definitely help support each other. So I know that was a lot to kind of process, and if you're not quite sure what's right for you, please give us a call and we can help you in figuring out whether home health, hospice, and or home care is appropriate for you and your loved one. To contact us, please go to our website at homehelpershomecare.com/Alpharetta. We look forward to hearing from you.